Good morning and welcome to Dr. Marra's Medical Minutes. This is the second video, and today I'd like to talk to you about COVID in dogs. And this is near and dear to my heart because I lost my beautiful cream French bulldog to the complications of COVID. In September of 2023, I contracted COVID from someone, and I actually was outside when I got it. We were having dinner on my porch, and he didn't know that he had it, or that he had been exposed, and he exposed me and my two dogs. I got sick immediately, but I went on all of the things that we know that work. I did take ivermectin, I did take Paxlovid, and I took a host of nutritional supplements to help quell the cytokine storm and help with my energy. And I got over it in about a week. I was sick for about a week, and there were lingering effects for about 6 weeks. And those lingering effects were largely in my chest because that's where I had a previous injury from my horse accident. And so we know that COVID and tick-borne illness, those organisms are very attracted to tissues that have undergone a previous injury. And it is believed that those tissues emit pro-inflammatory cytokines, which act as chemoattractants to the organisms. And that's why those tissues that are vulnerable become reservoirs for pathogenic organisms. My dogs both got sick, and the way that it manifested was they were fatigued and they had rhinitis. And neither one of them ever had rhinitis, and both of them were high energy before, and they were fatigued. And that lasted for, I don't know, maybe a couple weeks. Then in late November, so almost 2 months later, my white French bulldog, who was 8.5 years old, she started dragging her hind legs, and she was behaving strangely. She wouldn't jump down off the bed. So I went to the vet. I told her what was going on. They put her on they thought that there was a pinched spinal nerve. They put her on some pain meds like tramadol and Rimadyl. Nothing really worked. And the dysfunction in her back legs kept getting worse. So much so that eventually the vet sent me to the neuro-ER vet in Linwood, and she underwent a whole lot of nasty tests like a spinal tap and a brain MRI. And lo and behold, she had something called meningoencephalitis, which is a brain infection of the meninges, which is the outer covering of the brain, and the brain. This is quote unquote common in certain dog breeds like pugs, Boston Terriers, French bulldogs. And so they didn't think anything of it. But in my gut, I knew that it was correlated with COVID because my animal had been sick and showing signs of sickness since she had gotten COVID. Now, the vet told me that dogs don't get COVID. Well, that is not true. Dogs do get COVID, and if you Google it, you will find it. They don't present the same way as humans do, but they do and they can harbor COVID. Long story short, Charlotte got very, very sick. She had to go on prednisone and gabapentin, and she began to have ascending paralysis beginning in her feet. And every night, every day, she would just get a little more and a little more and a little more up her legs, across her spine, her thorax, her neck, and then down her front legs. And eventually she became paralyzed from the neck down, and she couldn't walk. and she was having difficulty peeing and pooping, and eventually at the end she couldn't pee or poop, and she had a grand mal seizure, and and then that was it. So my point is this: if your animal is sick and you suspect that they have been exposed to COVID, I would go to your vet, I would take your positive COVID test, and I would tell them of your um, observations of your dog, and I would ask them if they'd be willing to treat your dog with ivermectin, because had I done that, Charlotte would probably still be alive and she would not have developed meningoencephalitis. But I didn't know. I just didn't know. And I'm embarrassed. I'm embarrassed as a practitioner that I didn't know. And that's why I'm sharing this story with you, because it is so sad and so profound. And for those of you that know Charlotte, you know she was very, very healthy. She ate better than me. She was in mint condition and never had anything wrong. So I'm sharing this story so that you can learn from it and that you can take the information and use it in your life. I hope this is helpful. Have a wonderful day, and we'll see you again soon.